Good afternoon. My name is Dr. Johanna Olson-Kennedy. I'm a U.S. trained board certified pediatrician and adolescent medicine specialist. I've been doing care for trans and gender diverse youth for the past 13 years. Very excited to be here. I'm the medical director of the Center for Trans Youth Health and Development at Children's Hospital, Los Angeles. We have about 1,400 young people actively in our program right now between the ages of 3 and 25. I think that there's a fundamental disconnect between making a recommendation to start puberty blockers in early puberty and then not to add on gender affirming hormones until around 16. And I think part of that is because the protocols and the recommendations are kind of catching up with the clinical work, and there's a little bit of a disconnect. So immediately when the Endocrine Society released these recommendations, the first thought that I had was, wow, if I block someone at 9, that means they could potentially be only on blockers until they're 16, which actually can potentially provide danger or potential harm to their bone density. And so I really do think that it is important for us to acknowledge that people aren't supposed to start puberty at 16. Actually, in other medical situations, for example, when people have precocious puberty and they start puberty at the age of 5 or 6 or 7, they go on blockers until they are 12. And then across the board, those blockers are taken away and that person goes through puberty. And the reason that is because we have an understanding as a medical and scientific community that people go through puberty at around 12. That's kind of a midpoint for puberty, except if you're trans. And then you have to wait until you're 16, which doesn't make sense in the context of our understanding of development in adolescence. We understand this so that if you go through puberty at 6, if you're starting puberty, no, you need to pause that until you're 12 to give you time for a bunch of things, linear growth and other things. Doesn't make sense that we're applying a different principle of development to trans kids. It doesn't make sense for people to go through puberty at 16 for a variety of reasons. One, it means it exposes them to only being on blockers for a very long period of time. 2, when you go through puberty, your process of puberty, the stakes are different when you're 16, 17, 18 years old. When you're 11 or 12 and you're going through puberty and you have your hormonal surges, you slam the door and tell your parents you hate them and they don't understand you and they never will. But when you're 16, 17, and 18, you have access to vehicles, you have access to other adult human bodies, you have access to drugs and alcohol and a lot of things that you don't have access to at 11 and 12. And we don't often think about the potential consequences of waiting until someone is much older to start their puberty process. We start people, for example, on psychotropic medications, and we don't know if those are going to help people. We don't know if they're going to make people less anxious or less happy. We just know that, okay, well, it has worked for a lot of people, right? Just like blockers and hormones, they work for a lot of people. And so we go forward with that assumption. If it's not working, we stop, or we increase the dose, or we try a different medication.
Many of us have done things in our lives that we felt pretty certain about. And then we arrived someplace and we were like, oops, like that did not, whether that's marriages or careers or moves or children, there's a whole host of things, right? And that's true. That gets to be true of trans people as well. That we don't have to be scared of people making a different decision and moving in a different direction. If we talk openly about it, we can sort of remove the fear of it and people can feel safe to explore themselves.
Establishing one singular protocol for this care is very problematic, as every individual has their own pace of development and their own thoughts and feelings about it.
In the States, are prostate hormones available for non-binary people?
Yes.
Yep.
Folks who are endorsing non-binary identities, we have conversations about how they want to wear those genders, how they want to wear that particular iteration of their gender, and what hormones can and can't do around that. There are some people who really specifically want to be non-gendered at all when people see them, and there's some people who say, well, my gender identity is non-binary, but I want to present that in a more feminine or a more masculine way. And that conversation is obviously an evolving one over time and may change over time. Gender expression is incredibly fluid for all humans, including cisgender people. And so having these conversations about what elements of your physical body do you want to impact or might you want to change? I've had non-binary folks assigned female at birth who take testosterone for a year and they know they're going to take it for a year and they stop after their voice goes down or, some other element of their physicality changes and they're feeling comfortable in that presentation. A lot of non-binary young people assigned to female at birth really only want chest surgery. And that's a critical piece for them in order to express their gender in a way that feels most authentic for them. People who have not gone through their third or fourth stage of puberty are not going to have fully developed egg follicles that they can use for fertility preservation. So what does that mean? That means as medicine stands right now, if somebody is on blockers and they progress onto gender-affirming testosterone treatment later, and they continue on that through their lifetime, they're not going to have fully developed follicles and they will not contribute biologically to their own children.
Give things up with the understanding or the hope that what we get is going to be worth whatever it is that we're sacrificing. And that there are tons of people who would love to genetically contribute to their children who, because of just typical or sort of normal, if you will, biological or sort of medical circumstances, cannot. And that is sad. That is absolutely sad. And as trans folks, we should also be given the right to say, I don't get that. And I feel sad about that. And I feel angry about that. And I'm grief stricken about that. And allowed to sort of go through that process. But to not use that potential process or experience of sadness about what we don't get as a reason to not give us what we need.
I think this is a really interesting space to understand is that in the United States, the FDA has approved nothing for gender dysphoria, nothing. So not gender affirming hormones, not blockers. There's two particular kinds of blocker implants, and neither one of them is approved for gender dysphoria. And so if you're going to do gender affirming hormones or blocker care for trans youth, all of it is not FDA approved.